video for health, and we're doing drugs. And I'm here with Andres Vecina and me. So, antidepressant drugs are medicines that reduce symptoms such as extreme sadness, hopelessness, and lack of energy that characterize depressive disorders. Depressive disorders may either be unipolar depression or alone, or bipolar depressions alternating with periods of extreme excitation or mania. The former diagnosis requires a cluster of symptoms lasting at least 2 weeks. These symptoms include, but are not limited to, mood change, insomnia, or hypersomnia, excessive sleeping, and less interest in daily activities formerly found enjoyable. The symptoms are not caused by any medical condition, drug side effects, or adverse life events. The condition is severe enough to cause clinically significant distress or impairment in social, occupational, or other areas of functioning. Secondary depression or depression caused by favorable check. And it's now Andres' turn.
Antidepressant use among Americans is skyrocketing. Adults in the USA consume 4 times more the antidepressants in the late 2000s than they did in the 1990s. As the third most frequently taken medication in the U.S., researchers estimated that 8 to 10% of the population is taking an antidepressant.
Don't shoot or
Because tetracyclics and typical drugs are indivisible, there are no group patterns of adverse reactions. Specific reference.
The complicated parts.
Okay. There are no group patterns of adverse reactions. Specific references should be consulted. Antidepressants may have significant cautions with adverse effects. Although a few are listed here, specific references should be consulted for more complete information. In October 2004, the FDA issued a warning that threatening children and adolescents with SSRIs increase the risk of suicidal thoughts and behaviors. In a review of 2,200 children treated with SSRIs, the FDA found no individual complete suicide, but did find a 4% increase in suicide thinking or behavior, including suicide attempts in 2006. This warning was extended to complete all people under age 24.
However, in April 2007, a comprehensive review of SSRI treatment in children, adolescents, and adults under 25, published in the Journal of the American Medical Society, indicated that the benefits of treating these patients with SRIs generally outweighed the risk to reduce the risk of suicide. SSRIs should only be prescribed by a psychiatrist, not a family physician. And parents and caregivers should be alert for any of the signs of potential suicide or self-harm. Behaviors. In general, only fluoxetine had been shown safe for this age group as of 2016. Other SRIs or SNRIs should be used only when necessary enough.
Oh my God!
The most common side effects of SSRIs are dry mouth, dizziness, sour or acid stomach or gas, heartburn, decreased appetite, stomach upset, nausea, diarrhea, sweating, headache, weakness or fatigue, drowsiness, insomnia, nervousness or anxiety, tremors, and regarding tricyclic antidepressants, amitriptyline might be prescribed rather than a neuroleptic.
Major tranquilizer, but displays some of the more serious effects of the neuroleptics, including tardive dyskinesis, drug-induced involutionary movements, and neuroleptic Magellan syndrome, a potential fatal syndrome with symptoms including high fever, altered mental status, irregular pulse or blood pressure, and change in heart rate. The adverse effects have not been reported by other tricyclic antidepressants. The most common side effects are dizziness, drowsiness, dry mouth, unpleasant taste, headache, nausea, mild tiredness or weakness, increased appetite or craving for sweets, and weight gain. These problems usually go away as the body adjusted to the drug and not require medical treatment.
More serious side effects are not common but may occur. If any of the following side effects occur, individuals should check with the physician who prescribed the medicine as soon as possible. Blurred vision, eye pain, confusion,
Hallucinations,
fainting,
loss of balance,
swallowing problems,
difficult speaking,
mask-like face,
shakiness or trembling,
nervousness or restlessness,
movement problems such as shuffling walking, stiff arms and legs, or slow movement.
decreased, faster irregular heartbeat,
Constipation,
problems urinating.
problems
Problems have been reported in babies whose mothers took tricyclic antidepressants just before delivery. Women who are pregnant or who may become pregnant should check with their physicians about the safety of using tricyclic antidepressants.
tricyclic